So how are you and your staff feeling about this coming winter out here in counties?
Look, I think we're recognising it's going to be challenging.
Winter is approaching, and with that comes illness and pressure on our health system. The Herald has exclusively obtained a report written by clinicians, which provides a window into what really went on at one of our country's busiest EDs last year.
In the space of just over 1 month last winter, more than 1,500 patients were treated in corridors here at Middlemore Hospital's ED. Patients were put at risk due to overcrowding and a lack of staff. So what exactly has changed to prevent this happening again this winter?
To be precise, 1,536 patients received care in an inappropriate clinical space or a corridor. That was the number between July 1 and August 5. So in just a 36-day period, that was under review.
As Director of Counties Manukau, is it acceptable to have that many patients in corridors in the space of just 1 month?
Well, we don't want patients in corridors. I don't want patients in corridors. No one does. And so we're working, and part of the process of doing this review was to have a look at it and see what we would need to implement to prevent that. So yes, we do have people in corridors at times, usually for short times.
Is that a suitable clinical space though for patients to be cared for?
It's not a perfect clinical space, but it is a space where people can be looked at when they've been assessed and supervised and moved in, so we know what their clinical condition is.
But essentially it means that the ED at that point in time is overrun. You don't have any beds, right?
At that point in time.
It wasn't hard to find people who had experienced Middlemore ED when it's busy.
I think it's overrun, mate. I think that, I just think it's overwhelmed.
You can't even get a room or anything like that. It's that busy.
So at Middlemore, Sir, you or a family member were in corridors?
We were there with Dad.
Yeah, with her father, yep.
And do you think that's acceptable, sir?
No, not at all. Shouldn't be.
No.
Not in Auckland. Not in New Zealand. It's ridiculous.
This mother and daughter had concerns about staff workloads at all hospitals.
And people slipping through the cracks.
Yeah.
What do you mean by slipping through the cracks?
I don't know, not getting the care that they need when they need it.
Yeah.
Because staff are so stretched.
More staff should be put on the ward so that they're not overloaded for work. But there just needs to be more money to be put into the system so people are absolutely covered every way. It's just not fair on people, and it's not fair on staff.
The report, a quality alert review, was clear in the concerns it raised. ED overcrowding is contributing to suboptimal staff and patient safety.
Isn't the issue here is that patients coming in to be helped are on occasion being put at risk because of how understaffed and overrun the ED is?
Yeah, on occasion that will happen due to these pressures on increasing presentations and demand.
And does that worry you as head of this region?
Of course it worries me, which is why we looked at this report and we looked at solutions to try to improve that.
Other substandard clinical areas used to care for patients included ambulance waiting areas, which is this corridor. Treatment also happened in waiting room areas, including on plastic chairs, the floor, and in cars. The report warns the overcrowding was predicted and likely to occur again.
The report also highlights 43 separate incidents involving patient harm. The issue, again, related to ED overcrowding and a lack of staff. Is that too high for your liking, having 43 events
we would
in
want
36
no
days?
events happening every day in a hospital because, in the total number of patients that we see, 125,000 patients, we would want none.
Well, it must be hard on your staff, right? Because some of these events that occurred were the direct result of inappropriate medical interventions, or they were the result of just poor care. All of them were linked to overcrowding or a lack of staff, not having enough people on. That puts huge pressure on your colleagues, doesn't it?
Yes, agreed. It is pressure on the staff. And when our staff are have illness and other things, it does put pressure on the other staff, and we try to replace. It's actually very difficult to replace, if a quarter of the staff is sick on a day, it's hard to replace.
As part of the review, staff submitted feedback on how they felt. The comments were scathing. It, reported ED overcrowding incidents, does not show the old ladies who wet themselves in the corridors because there's nowhere else to go, one staff member said. Another wrote the issues are certainly not visible to our politicians. To say that the ship is sinking and no one is coming to help is an understatement.
Do you sympathise with that comment?
Look, I think I do sympathise with that, because on some days it can be very challenging for staff, and it feels like that they're not getting the support that they need at the time.
Clinicians who compiled the report wanted action. They wanted the review escalated up the chain of Health New Zealand, and one of their key requests was $3.6 million to fund a new fast-track model of care for this winter. That funding has not been forthcoming.
I guess reviews are important if the clinicians who write them are listened to.
Yeah.
Are they being listened to?
Absolutely. We reviewed that paper. It was endorsed by our leadership team.
Did you get that money?
We're in a budgeting process on acute flow as we speak, and we're hoping to get some money towards that.
Will you get all of it?
I'm not sure yet, to be honest. We're right in the middle of budgeting at the national level, so we're hoping to get some resource towards that.
Dr. Vanessa Thornton says there have been some wins for under-pressure staff. A new 22-bed ward will help share the patient load, and ambulances can now be diverted to other EDs during peak demand. She also says backup staff from other departments have also been identified to help if, as the report predicts, Middlemore faces emergency overload once again this winter.